You are listening to the Horse Radio Network, part of the Equine Network family.
Greetings, everyone. Coach Jen here, and thanks for tuning in to Horse Tip Daily, episode 1568, brought to you today by MyNewHorse. Today's tip features Horses in the Morning co-hosts Glenn and Jamie, along with their guest, Dr. Madison Seamans, and they're all chatting about the most interesting topics presented at the 2024 American Association of Equine Practitioners Conference.
For first-time horse owners and new riders, finding the information and support you need can be challenging. That's why Equine Network has partnered with Sentinel and Absorbine to bring you MyNewHorse. From important horsekeeping information and how-to videos to social media communities, exclusive experiences, and more, MyNewHorse is your one-stop shop for riders of all levels and disciplines looking for easy-to-understand horse care information and guidance. Start your horse ownership journey today. Visit MyNewHorse.com.
Well, Doc, thanks so much for joining us again. Appreciate you coming back.
Oh, thanks for having me. I'm just tickled that you'd want to talk to me again.
Well, you were at the AAP down there right below me in Florida, and we like to get a report on what all the new and exciting stuff is coming out of the vet world. So what's new and exciting? What caught your eye?
Oh, man, there's just so much out there. It's just hard to kind of distill it down to, bite-sized little morsels. For just a little history, my first attendance to the AAP, we've been an organization since 1954. And the first meeting I attended was in 1984. There were 600 veterinarians for 2 days of nothing but new stuff. And you roll out of there like drinking out of a fire hose, you know what I mean? There's just so much new information out there. And I walked away from that meeting 40 years ago thinking, how much more could they possibly know? Well, fast forward 40 years, there was 5,000 veterinarians there for 5 days.
Really? 5,000?
So many venues, speakers going on at one time. You just have to pick and choose who you're going to sit with because it's so intense. I come home and sleep for 2 days because your brain just gets overloaded. And I told somebody it's my brain is just old, and she said no, it's just full. So that's a better way of looking at it.
All I'm thinking about is the horses out there who didn't have a vet for 5 days because all of them in the country were in Florida.
Exactly. They put their illnesses on hold.
Nobody's allowed to get sick this week.
But some of the new stuff that's coming out is kind of either a reinforcement or a refutation of stuff we've been doing. One of the things that really caught my eye was some of the biologic treatments that we're using on arthritic patients and also soft tissue injuries. We've been using stem cells in horses now for over 30 years. We're way ahead of our human counterparts in being able to do this. And like anything, it kind of goes through anything new, like a new drug or a new procedure goes through 3 phases in this life. The first phase is it cures everything. The second phase is it doesn't do anything. And then the third phase is usually 5 to 10 years down the road. Okay, this is what it'll do. So that's kind of where we are in stem cells. And I found it really interesting. There was a study out from University of Georgia Veterinary College. And about 3 years ago, there was a paper published that said that the stem cells that were going to work in the horse had to come from that horse. So there's places that you can buy stem cells online. They're called banked stem cells, and so they take cells from a horse, they grow them in culture, and they just sell them to you. The problem with that is that those stem cells are a tissue. It's like an organ transplant, and so if they're not matched, the recip's not matched to the donor, it's going to get rejected. And so there was a paper out 3 or 4 years ago that said that these banked stem cells wouldn't do a darn thing for the horse. And so there was another paper that confirmed that out of the University of Georgia, that within about 90 days of putting these banked stem cells into the joint of a recipient horse, there was no donor DNA left. And so, those stem cells just get chewed up by the immune response. So I think the beautiful part about this is these things do tend to help in a lot of areas, but they got to come from the horse. And so what we do is we take some fat cells, and then some of the labs are actually just taking some white blood cells, and you send them off there, and they will actually grow stem cells in the lab. and sends you back, hundreds of millions of them in a test tube, that you can now put this back into the horse, and it's his DNA. It will not be rejected. And I thought the work that they did in order to understand these concepts is just fascinating. And these things show real promise, especially for our athletic types that are really competing hard, that really do have a lot of wear and tear on their joints. And these things are really helping with not just arthritic conditions or joint problems, but also with soft tissue injuries as well.
That's also true in humans, isn't it? You need your own.
Absolutely.
Yeah.
Absolutely. You can't just go down to, Kidneys R Us and get one. I mean, it has to be matched.
Well, all right. So what else?
Other things, there's an arthritic condition called ring bone. And that's some little bony spikes that are in the usually in the front part of the pastern.
Jamie has one right now on her shoulder.
I also have a horse with a very severe case, so you've got my attention.
Yeah. And so historically, we've thought, you look at these things radiographically, and there's just a whole bunch of spurs outside of the joint. And so historically, we've thought, well, there's just bony proliferation there. It's rubbing on the soft tissues around the joint. It causes pain and lameness. And there's just not a whole lot we can do for those. And boy, a study that was shown, it was an anatomical study that was done. I can't remember who did it, but anyway, that joint, that coffin joint, extends up that pastern a remarkable distance. And so the MRI studies on horses that have these ring bone-like lesions in the lower part of their pastern, if you look deep inside of that joint is involved as well, the coffin joint, the joint between the short pastern and the coffin bone itself. And knowing that, we know now that there's a bunch of that pain is actually coming from that joint. And so there's some biologics, they're called polyacrylamide gels that actually get incorporated into the synovial lining of joints. So it's an artificial substance, but it gets incorporated into the mechanical stuff of the joint that really helps these horses. And so, man, that just has given me a whole different approach to the way I look at ring bone now. And so I got a handful of patients that I'm just dying to try this on as soon as I get back to work here this week. So that part was very interesting, and it just gives us some possibilities that we didn't have before.
It gets injected right in to the spot,
right into the coffin joint. Now what looks like what the problem appears to be is some really rough bony proliferations outside the joint, way up on the short side of the pastern, on the front side of the pastern. And you wouldn't think that there would be a connection there, but these MRI studies showed that those horses that had those bony proliferations also had problems down in that joint. So it may well be that we can start treating that joint, although it looks remote from the actual process, the actual pathologic looking stuff on the x-ray. We can start treating these joints and maybe help some of these horses. And that was very encouraging.
Well, it's no different than grease. Why don't we just put a grease fitting on it? I mean, that's basically what you're doing is greasing it up.
Yeah, it's a high-tech grease.
Yeah.
Now, maybe you mentioned this, but what is kind of what would you inject into the coffin joint to help with the ring bone? It's called a polyacrylamide gel, and it's actually a synthetic substance. And we've been using that now. There's several different brands, which is evading me at this point. There's a couple of them out there now, and it's yeah.
No. That high-visc is hyaluronic acid. It's something that's totally different. Although that would be something somebody could try.
Okay.
But what this is, it's almost like a silicone. It's a gel, but it gets incorporated into the synovial lining so that it increases and changes the function of the synovial lining that makes the joint slick.
Well, if you want to come practice on anybody, you just come on out, baby, because I got one in the barn that's just dying for it.
I'll tell you what. Well, you just need to talk to your veterinarian and see if they can look that up online. And if they're a double AP member, it'll be readily available to them.
Gotcha. Well, I'm going to go to my vet right after I go to Kidneys R Us and do some shopping. Well, before we let you go, I got to let everybody know what Dr. Seamans does. Okay, so you're listening to him and you're like, this dude tells it like it is. And I'm not kidding you. He does. So if you are having an issue with your horse, or you get some x-rays, or you have questions, like I had a horse that a veterinarian told me would be fine with the x-rays, and an ultrasound and a tendon one time as well. If you go to cornerstoneequine.com, one E in between Cornerstone and Equine, he does virtual consultation services, and Dr. Seamans twice now has saved me thousands of dollars and 2 fairly big heartaches, because he will tell you how it is. So I can't thank you enough. I don't know if you understand how valuable those things were to me, Dr. Seamans. I really appreciate it. And I just having you in my pocket, to like whip that card out. But I know this guy, you got to tell me how it is. But twice now he has saved me. So I just wanted to say an official thank you, and to let everybody know, $95, and you will, you saved me thousands of dollars and a year of my life.
How do people find you to do that, Doc?
It's cornerstoneequine.com.
Okay, very good. Well, Doc, as always, thanks for joining us. We really appreciate you keeping us up to date on all the veterinary world.
No, you're too kind. You're too kind. And don't forget the book, Never Trust a Sneaky Pony, and Other Things They Did Not Teach Me in Veterinary School, available on Amazon audiobook as well. And I performed the audiobook.
Well, there you have it. Horse Radio Network has thousands of engaging podcasts for horse people, and you can have them sent right to your phone. Just subscribe via your favorite podcast player. This is Coach Jen, and I will be back again soon with another tip. Until then, go ride your horse. The Horse Radio Network and the Horse Radio Network hosts are not responsible for statements made by guests on the Horse Tip Daily. Please use your own judgment when listening to the tips on this show.